WBCK, here we are on Tuesday morning. You know, we've talked at various times on the program with folks who have brought up the idea that when you take a look at the population in Calhoun County and juxtapose that against the number of medical professionals, doctors in Calhoun County, that we are underserved. And so it's my pleasure to introduce you to Dr. Simone Bruemmer, who is now practicing family medicine in Battle Creek at Bronson. Good morning, doctor.
Good morning.
We need you.
Thanks for having me.
We need you. We're glad you're here. When did you come to Bronson?
I started the beginning of August.
Okay. Why did you become a doctor? These are always interesting stories to hear doctors talk about what motivates them.
Sure. Well, I like to interact with people and hear experiences. So I like to learn from people, try to find the best ways to help them improve their lives. And, you know, when you go into medicine, you can work with people or you can sit in a lab. So yeah. I'd rather work with people.
That's right. There's a choice there, isn't there?
There is. And it's a big one. So I enjoy it.
What types of patients do you see?
All ages. Okay. All ages, from newborns to seniors, men, women. I see patients who are very sick and complicated with long-term conditions and people who are generally healthy and just occasionally need to be seen.
Mm-hmm. That's what's considered family medicine, right?
Right. We see everything, and we're generally considered the starting point when people need assistance.
Yeah. Do you have any specific interests in certain medical conditions?
Like I said, we do a little bit of everything. So I do a lot of women's health, but I have a lot of male patients too. I just like following people for their whole lives. So whatever comes at them, that's what I do. Yeah,
you know, that is often what you hear people say when they talk about their doctor. Oh, I've been seeing this doctor for years. People really depend on that, or at least they get security out of that, don't they?
Absolutely.
Yeah. Why is that? Is it because people don't like to start over, or they feel like that person knows me, or what's involved there?
You know, it may be a little bit of both.
Yeah.
It may be a little bit of both. So, you know, what I like the most and the biggest compliment that I can get when I know I'm doing a good job is when somebody wants to bring their family members.
Oh, sure.
And so someone comes, they meet me, and then they're like, oh, wow, this really went well. I'm going to tell my friends. I'm going to bring my family. That's when I know I'm doing a good job. So hopefully that's the reason people want to stay, not just because they feel like they have nowhere else to go or whatever the case is. That's what we strive for.
Yeah, it's something of an endorsement when they do that, isn't it?
It is. Yeah. It is. It's the biggest compliment that I can get.
Are you accepting new patients now?
Yes. We have a lot of availability right now. We're a brand new clinic. So the good news is, for people that are looking for somebody, they don't need to wait 3 months to get in at this point.
Yeah. You know, one of the things you hear sometimes from folks is that doctors are stretched. They come in and they quickly see you and quickly go out the door. Is that something you're mindful of?
We're very mindful of it, and no provider tries to do that. That's not the goal of what they're trying to do. Yeah. As you mentioned earlier, it's very underserved in many places, so things get booked. But as long as we can, we're going to try to spend as much time as we can with people and get done. We're never going to cut somebody off.
Yeah.
If they need help, that's what we need to do.
So when folks come to see you, what should they expect?
So, you know, we want the patients to be a part of the decision-making process. I'm not a doctor who wants to overwhelm a patient with, you know, well, this is just how things are. I'm the doctor. I said so. I view my service to patients as a collaborative effort. I need to know what's bothering someone the most and what will make the biggest difference in their lives. And then together we can come up with a plan that will help be possible and be safe. So we try to do a complete team effort in providing that.
So if someone wants to make an appointment, what should they do?
They can call the main Bronson line, or we have a phone number directly for the office, too, if you'd like that.
Yeah, right. Go right ahead.
So it's 269-245-5430.
All right. Dr. Simone Bruemmer is with Bronson in Battle Creek, a new practice, and ready to talk to you. And if she's made an impression on you, you can call 245-5430 for more information. Dr. Simone Bruemmer. Thank you for your time today. We appreciate that very much. Welcome to Battle Creek. 8:51 National Weather Service.